Nothing's off limits with this duo. It's father and daughter, Don and Cher. And join the club if you're a chattermouth.
Hey y'all, it's Cher and
Dawn.
And welcome back to the
Chattermouth Podcast.
Today, back by popular demand, is my husband, Dr. Jared Gopman, a plastic and reconstructive surgeon. Today we wanted to talk about plastic surgery and social media and how social media has been playing a big role on these plastic surgery trends. So, Dr. Gopman, we are so happy you're here. Thank you for coming on the Chattermouth Podcast.
Thanks for having me back.
And
Glad to be here.
Just so everybody knows, in case you have missed other episodes, my husband, Dr. Gopman, is a plastic surgeon and reconstructive surgeon trained. He went to Mount Sinai Hospital in New York City, and he did a fellowship as well. So he is very well qualified to talk about all of these topics. Anyways, okay, so let's get right into it. Today, I see so much going on in social media. It really has such an impact in making you feel a certain way. I noticed that Snapchat dysmorphia, Instagram dysmorphia has become such a hot topic. You know, even I, unfortunately, am subject to it. I see myself in a filter and I'm like, wow, I look really good if I had bigger lips, smaller nose, higher cheekbones, or whatever it is.
Sure.
Do you have patients that come to you and are saying, I want to look like this filter image of me? And what do you do about that?
It's very tough. So back in the day, we would compare ourselves to people we knew, right? Because we would only see people that we know or the people in magazines, models and things like that. And it was so hard to compare yourself to something that wasn't directly in front of you. Now with social media, you're comparing yourself to people all over the world, millions of different people that are on these apps, and they're all doing different things to put the best image of themselves forward and to show something that maybe not even isn't real, right?
Right.
We know there's all these techniques to contour your face with makeup, to make your nose look thinner, to make your cheeks look bigger, and to make your jaw look slimmer. And there's all these things that girls are doing, and guys, to make themselves look the way that they want to look. There's also these filters, which I think you touched on with Snapchat dysmorphia, that literally can make yourself look different. And if you're using these filters all the time, you're making yourself look like this version of yourself that may not be real.
Right.
And then influencers, their job is basically to influence everyone else, right? So they want to look like the best version that everyone else wants to be so that they can kind of be the model that people want to follow. So all of these things may combine to kind of an unhealthy obsession with getting to this image that you may not even ever be able to get to.
Right.
So what happens if the patient comes into your office and say, Dr. Gopman, I would like to look like this, and they show the filter of themselves. What do you say or what do you do?
So it's difficult because there are these technical and kind of historical common concepts of beauty, right? There's signs of youth and then there's signs of aging. And everyone's trying to chase these signs of youth so much that sometimes it becomes like an extreme deviation. Let's first talk about, just for example, like eyebrows, right?
Right.
Eyebrows are supposed to be above the kind of the bone of your eye, what's called the orbital rim, and they're supposed to be slightly above. In guys, it's supposed to be at or slightly above. In girls, it's supposed to be a little bit more, especially the tail end of the brow, right?
Right.
But now you see women are getting, and even guys too, are getting the tail end of their brow lifted so high, it's giving them this almost
cat eye,
or almost this like alien look where their brow is lifted so high it almost makes like a C shape instead of a slight gentle curve. And that's due to the Botox that people are getting. That's due to people plucking their eyebrows specifically to look like that. And then tattooing eyebrows on. And that's due to brow lift techniques that are pulling the eyebrows so high. So there's all these things they're doing where you take something that's the common perception of youth and beauty, but you're taking it to such an extreme that it's almost giving you like an alien style look. Take the cheekbones, for example. The common sign of a youthful, feminine cheek is to have these high set, prominent cheekbones, right? So what are people doing? Well, they're getting all of this filler put into their cheeks right here and giving them these puffed up cheeks to try and chase this concept of beauty, but they're overdoing it. These providers who may not even be physicians at all, nurse practitioners or physician assistants or even nurses or even estheticians are injecting people with cheek filler in order to give them this look that they want, but ultimately, sometimes they just want to sell the product, right? Because the more...
And they make commission.
Because they make commission, and the more product they inject in your face, the more money they get. So they're incentivized to give you more. You are trying to chase this look that maybe you already probably have gotten there, but you aren't really knowing when to stop.
Right.
The problem with filler, I think, and I know I'm ranting here, is that people don't know when to stop. I've always told you that I'm very conservative with filler because you can always add more.
Right.
But the more you get, and it's not this like huge difference overnight. It's a slow progression where every couple months you might see, or even every year, someone gets a little bit more and a little bit more, and they slowly progress themselves from looking, refreshed and youthful to this like alien-like appearance with huge cheeks and high brows and no fat in here that look like the totally gaunt and a huge chin and jawline and all these things. That's due to these chronic injections repeatedly because the providers who are doing it don't know when to say no.
So if a patient comes in and says, I want more filler on my cheek, and you're saying to yourself, no, this is just, this is too much already. Do you say to the patient, I really believe that this is too much, and will turn the patient away?
Yes. So the spot that I commonly have issues with is the lips. Girls want these huge lips, right? Because of
Like
celebrities,
Kylie Jenner, all of that,
that popularize these giant lips, and these celebrities will lie to the public and say, oh, I'm just using my lip liner, or I'm just using like lip gloss, and I'm not actually doing anything, when they're secretly getting plastic surgery because they don't want to admit it. But that drives people to try and get plastic surgery to give the lips that look like them. And it's become this obsession with huge lips. The problem is that as you put more and more filler in, it stretches out the tissue. And over time, the tissue elasticity, which is the ability of the tissue to contract back to its original spot after the filler, which goes away, which it does, the elasticity isn't possible anymore. So what happens? The lip sags down.
Wow.
So now you're in this situation where you have these saggy lips that you have to keep getting more filler to continue to keep the appearance up. Otherwise, you'll never be able to look normal again.
Because you can't really fix lips. Is that correct?
Like, can you do plastic surgery on lips?
You can. There's a way to reduce the excess volume by cutting it out, but then you have to have scars that we hide on the inside of your lips. But if you have this excess hanging skin on your lips or excess lip tissue, just like anywhere else in the body, the only way to really treat it is to remove it.
Wow. And it's interesting because lips were so in. Like, the bigger the lips, the better. And it was so in. But actually, there's been a recent change in that. And a lot of people are having their filler taken out of their lips and it's going back down. So it's crazy. All these trends make you want to do all these things. But then now a lot of people are probably left with like stretched out lips. And that's not fun.
Yeah, there's always this trend that goes towards more and more and more. And then after so many people do it, we start to see the problems with it. Lips are another one. Another big one that we've seen is buccal fat pad removal, right?
Yeah.
Yes.
Buccal fat pad removal is a very easy to do procedure.
Can you explain what that is?
So if you look kind of right in the front part of your face, kind of right by the cheeks, where if I go like this,
where you suck in.
when I
So it's
suck
like
in
when
my
you
cheeks,
suck in, you have
that's
to
your
suck
buccal fat.
Right.
So a lot of people want to have these thin, kind of
High
gaunt cheeks,
cheekbones.
high cheekbones with gaunt on
So like a
submalar
contour.
or gaunt cheeks that kind of has that model look. So it looks very contoured and you have that very sculpted face. The problem with that is that as we age, having fat in our face is the only place we want to have fat, because having fat in your face is a sign of youth.
Right. That's true.
So if you don't have fat in your face, then everything starts to sag over time. So having more fat in your face is actually protective to prevent against sagging. So now we're starting to see all these people who have had their buccal fat pad removed, and by a simple surgery that is very easy to perform. So a lot of people are doing it. As they age, they're looking really old.
And it's irreversible, is that correct? Once you get the buccal fat pads removed?
You can inject more fat into your cheek at a later time, but then that's another surgery you have to get. You're right in you're saying that once it's removed, it's gone. So you have to have more fat added.
So
these
these young,
aging faster.
These young people aren't realizing and not thinking about the future.
Right.
So interesting. I always think about the future because I was thinking like when the trend of having like higher cheekbones was really in style, part of me wanted to have like filler put in or filler in different spots, but I'm always so worried about it like stretching out my skin, and then I'm gonna need like a facelift at a younger age.
Is it also true that when you have filler, some of it always remains? Like they say, filler will last for 5, 6 months, 9 months, but is it so that some of the filler never goes away?
So there are different types of fillers out there. There are fillers that are commonly used that most of it does dissolve. Some of it does stay, but the majority of it does dissolve and will kind of linger around. Then there's other types of filler that are meant to be permanent, that stick around and stay around. And you even in some cases could see them on x-rays.
Wow.
So there's not every filler is the same. So it's important to know exactly what you're getting and why you're getting one filler versus another one when you're going for this consultation.
Yeah. And also making sure you're going to a reputable place. I once worked at a place before this as a med spa, and they were trying to get they were selling all this Groupon, and they weren't giving like the full Botox units. They said I stopped working there because I was like, this is ridiculous, and I reported them. However, there are a lot of places out there when you're buying these Groupons, you don't know what you're getting, you don't know who's injecting it, and there are like counterfeit products that are out as well.
Yeah, that was a big thing that just came out. The FDA just released a statement about counterfeit Botox, that people are selling counterfeit Botox that's not real with complications.
Wow.
So you always want to make sure you're going to a reputable person. The problem with the business of beauty is that you only, as the provider, only make money by selling. So it's easy to get lost in the desire to sell and kind of lose your ethics.
It's so
Wow.
true. Yeah, when I worked at this place, the manager was like, you have to sell, sell, sell. He's like, I don't care what it, like, just sell. And I'm very, like, I'm not like that at all. I was like, no, like, I have to go by the person. And if I don't think that they should be getting it, I don't tell them to get it. And he would tell me, hold a mirror up and point out everything that's wrong with them
that's
and tell them what
terrible.
they need to fix that.
Yeah, that's
and
so
I was
mean.
like, I will never do that. Like, I could not. I had to stop working there.
The other problem with going to med spas is that there's a saying, when you're a hammer, everything is a nail. What does that mean? If your only solution to problems is fillers and injectables, then every problem a patient has, you're going to recommend these injectables because you don't have any other options. The nice thing about being a plastic surgeon is that I can decide if a patient should have just fillers and injectables versus lasers versus surgery. So I can adequately treat using a variety of techniques, both non-surgical and surgical, and I'm not keying patients into one specific treatment because that's the only thing I offer. Sometimes if a patient needs something and I don't offer it, I'll say, look, I really think that you should have this thing, but I don't do this. Like, for instance, patients come to me all the time for blepharoplasty surgery. And I do blepharoplasty surgery.
What is blepharoplasty surgery?
Lid surgery on the eyelids, the upper and the lowers. But if somebody has an eyelid that kind of falls and covers their eye, that's a separate type of surgery that I don't perform. That's called ptosis repair, and that's usually performed by an ophthalmologist or what's called an oculoplastic surgeon. So I will even lose the consult because I say, look, I can do a blepharoplasty on you. You would look great with a blepharoplasty, but that won't solve your problem. Your problem will still persist because you need a special type of surgery that I don't perform.
I love your honesty.
just
And
gonna
then
say.
you just don't do the surgery in order to make money on it. You'll only do surgeries that you know that you are great in and that you could actually help the patient. I mean, that's the best part of you.
Yeah, a lot of people just want the money and they'll just say, okay, I'll do this instead. But you're saying, like, no, this is what's best for the patient. And that says a lot. Sorry to pause the podcast, but if you're loving our podcast, then you'll love our book, and we have to tell you a little about it.
Actually, we wrote this book, and it's about how we got this close and how you can too.
It's called A Bond That Lasts Forever, and basically it goes over our life's ups and downs. It shows pictures throughout our life and has adorable quotes throughout to inspire other mothers and daughters to have their own special relationship. You can pick it up on Amazon.com, at Barnes & Nobles, or wherever you get your books. Now, let's get back to the podcast.
And oftentimes I'll tell a patient, like, look, would be a good candidate for surgery, but you're not ready yet. And delaying the sale, right? Because that's kind of against my own best interest. But like, say someone wants a facelift, but they're telling me, I also want to lose like 30 pounds first before getting a facelift. I'll tell them, you should wait till you get down to the weight that you're happy at, and then you should do the facelift. Because if I do the facelift on you, and then you lose 30 pounds afterwards, you're going to have a lot of sagging skin that you're going to need another facelift. So it's better just to wait to have the facelift when you're at the goal weight that you want to be at.
Talking about facelifts, would you tell the patient, let's say the patient has filler in their face, wait till the filler dissolves before having the facelift, or would you still do it with the filler in them?
Great question. So unfortunately, it's very difficult to wait completely till all the filler dissolves. And I routinely do facelifts and facial procedure on patients who have had previous Botox and previous fillers. But I will say that if you're considering a brow surgery, something to lift your brows, an eyelid surgery because you don't like kind of the hollowness under your eyes, or a facelift to kind of lift your cheeks, I would wait to have any sort of injectables until after that's done. Because your surgeon can even put in a permanent injectable, such as fat, that they take from somewhere else in your body into your face at the time of your facelift surgery. And that can really give you that better longevity. But if you have somebody put these fillers in, it can actually make your surgery more complicated, because the filler, if it's not done perfectly, can be in the wrong place and can kind of make the surgical dissection a little more complicated.
Interesting. Being that social media is so big, are you noticing younger people tending to go for facelifts at a younger age to have that more like tighter look?
Yeah, the worst is I once saw a girl who had previously gotten a facelift in her 30s.
Wow.
Because she was a model and she felt the pressure to have a facelift when she was in her 30s to stay looking that youthful look, because models age out pretty quickly, unfortunately.
Yeah.
And it's very sad because while there's no perfect age for a facelift, I will say that the best facelift will only last about 8 to 10 years.
8 to 10
The best
years.
facelift. And then gravity does take a toll.
So what do you do after that? Like, if it only lasts 8 to 10 years, what does a patient that had a facelift do?
So you'll never go back to that permanent like look that you had before a facelift. Just like if you have a breast lift, you'll never go back to that look before. The scar tissue will prevent some changes, but it is common that if you get a facelift in your 50s, you may at least desire another facelift in your 60s or 70s. The longer you wait before your first facelift, the longer you'll be happy with your results. That being said, if you're very unhappy with how your face looks, it's not a bad idea to consult with a plastic surgeon, because there may be other things that are not as invasive as a facelift that you can do that you don't even know about.
So interesting. What are some things you can do to prevent getting the facelift, that you can keep like good skincare? What are some things you can do?
The number one thing to prevent your skin from looking bad, in my opinion, is sunscreen. Sun damage, especially here in Florida, makes people look very old. It gives brown spots, red spots, makes the wrinkles come and looks very bad. The other thing that you can do is do not smoke. Smoking, not only the act of smoking gives you the smoker's lines, but smoking causes a bad effect to your skin, which makes you have more wrinkles. So the best people to have long-term youth and beauty are people who stay out of the sun, don't sunburn, don't suntan, and don't smoke. Those are the two biggest things. And then talking with your plastic surgeon or your dermatologist about products such as retinoids to help keep your skin looking youthful, and vitamin C serums and things like that to keep you looking youthful, and get on a good skincare regimen are also very helpful. The other thing is making sure you're always drinking a lot of water, staying well hydrated, and always taking good care of yourself by eating healthy and doing the right things for your body.
I heard that. I heard that alcohol can also age you too. Is that correct?
Well,
Drinking alcohol?
It dehydrates you.
Oh.
And when you're drinking, a lot of times it's associated with staying up late and not getting enough sleep.
Wait, I'm just confused. Why does drinking water play such an effect on aging? Because I don't drink enough water. I drink a lot of coffee, but I think that's the opposite. Like
I
dehydrates.
drink a lot of water when I wake up in the morning.
I know you're good at that. I
really
am not good.
try.
I don't like water. I don't like the taste. I know there's like no taste. I just don't enjoy it. But like, why is that so important?
It's just important to keep yourself well hydrated because so
Why?
much of our body is made up of water, and you really want to make sure you're well hydrated for so many reasons, not just for beauty, but just for overall health.
Well, when he said it can age you, now I'm going to start drinking more water.
I'm going to be drinking even more water than I already drink. That's a lot.
That's too funny. Oh man. And what are your thoughts on like preventative Botox? Do you think that's a good idea to start younger? Because that's been a big thing also in today's trends. People are starting Botox at a younger age. Do you think that's not a bad thing?
I will say that Botox is a preventative because the wrinkles that you get from the muscle movement do tend to worsen over time if you have never had Botox. So by having Botox, it can decrease the amount that your muscle moves, thereby decreasing the depth and the let's say badness of the wrinkles that you develop. Now, I don't want to say that everyone should get Botox because you have to decide if that's right for you. And I will also want to say that you can have Botox but not be totally frozen, right? You can have a lower amount of Botox placed and not be totally frozen. Some people want to be totally frozen, but a lot of the actors and actresses that you see on TV, they are very expressive, but they also get Botox.
Yeah. I have got Botox. Cher did Botox for me, and I can move my face completely, So I don't like being frozen at all. I want to have movement. I just don't want to get those really deep wrinkles or deep lines.
And I'll say personally, I used to have very, very deep wrinkles in my forehead, but then I got Botox a couple of times, and even when the Botox wore off, because it's not permanent, the wrinkles never came back as strong. So now I haven't had any sort of injections in like a year, I'd say, and the wrinkles still never came back as strong as they were before I ever got
Oh,
it.
that's wonderful. Yeah. I want to say, what do you think about like on Instagram and physicians altering their pictures to the befores and afters, and you're thinking thinking that, oh, that doctor's is doing such great work. I'm going to go to him and I'm going to have this done and that done because look at the before and after. But then you look at the picture and you're saying this is altered. And I'm saying,
you tell me that this is not
like,
real,
that's
Cher.
terrible. Like, what do you do about that?
Yeah. So
what are things people can look out for to
Yeah.
know if physicians' before and afters are real or not real?
So we have to remember that the pictures that you see plastic surgeons or anyone post on Instagram, the before and afters, they're for marketing.
Right.
Number one, we always will choose the best pictures possible. We'll always choose our best outcomes. We're not showing you all of our outcomes. We're showing you our best outcomes because that's what we want to market. We want to market ourselves in the best possible version.
But how do you know they're real outcomes?
Right. So it's important to see standardized before and after photos. And what does that mean? That means the same patient getting photoed from the same position in the same lighting. A lot of times what I see is that a surgeon will show a before picture and it's very dark lighting and patient looks terrible. You see all the wrinkles, all the shadowing, and then they'll show an after picture that's super well lit, very bright, and all of the wrinkles afterwards have faded out because of the bright lighting, which kind of tends to mask and soften everything.
Oh, so
Right.
interesting.
And while the results may be good, you can't really tell if it's real because the lighting is so different. So you want to try and get the best standardization in your before and afters, and that's how you can really tell.
Wow. So,
So-
lighting plays a big role on how
Well, it's the same thing with social media. Like I use a
That's
ring
true.
light because why? It softens the face. It makes you look
Yes.
brighter. It makes you look better. That's so interesting.
Wow.
Yeah. I love the That's so interesting. I do enjoy seeing before and afters. I love seeing your before and afters, but
Thanks.
I like that yours are all like the same,
I try my best to keep it
Yeah.
standardized to give an honest picture.
Yeah.
Unfortunately, we can't show nudity, so I have to hide the nipples, but I wish I could show them because I put so much effort into giving
Yes.
a nice, perfect round areola. That's like one of my things that I really try to do in surgery.
That's what
Right.
I love about you, Jared. You're so honest and ethical. I mean, your
Yeah.
ethical standards are so high, and that's what makes you you.
He cares so much, which is
Yeah.
awesome. It's so interesting for women in social media nowadays, since we're talking so much about social media, the big thing was always the filler, the bigger, the better. And for men, I've noticed a lot of men, you don't see as many men going bald these days.
Yes.
What is up with that?
Okay, so pretty much everyone has had a hair transplant. Every celebrity,
don't
male
really?
celebrity has had some sort of hair transplant.
Really?
The key is to get it done early before it really can tell the difference, right? If somebody goes from being totally bald to having a full head of hair, you'll know. But if someone has a little bit receding, maybe they hide it well, and then all of a sudden they look a little bit more refreshed, their hair looks a little bit thicker, you can kind of have plausible deniability, right? But a hair transplant is a very common procedure that I love to do for guys because it's so minimally invasive. It's very easy to do in terms of for the patient side because there's very little pain and very little risk of complications afterwards. And the way I do it, there's literally no scars.
I thought usually that it used to be a big scar on their back of their hair, and you would always see the scars. You always knew people had, a hair transplant.
Or you would see the points sticking up in the scalp of the hair, the hair would stick up.
Yeah. So back in the old days, the way surgeons would do it is they would literally cut a strip of hair out off the back of head, skin and hair, and then pluck the hair out individually, and then close the opening on the back of the head with a straight line scar.
Right.
So a lot of guys, if they cut their hair short, you'll see the old way where they have a scar on the back of their head. Right. Nowadays, I take each individual hair out using a very, very tiny drill that just plucks each one out, and then me and my assistants help to process each hair, and then we put them in individually across the whole head.
Oh my gosh.
It takes a lot longer. It's a long process, but it leaves you with no scar, even if you wear your hair short, and it has a natural look instead of having those big plugs like they used to do.
Right, you would see the plugs. You
Right.
used to see the plugs. That's what I was talking
I can't
about.
believe that all these celebrities that are not bald probably had a hair transplant.
All
That's
of
why.
them. All of them.
Wow.
So the success rate is really great with hair transplants.
I think
correct?
that over 95% of guys, the first thing they say is, I wish I did this sooner.
Oh, that's
They're so
amazing.
happy because it really
Built their confidence.
100%. And it gives you that youthful feeling that if you have a full head of hair, even if you're in your 50s, you still look young and you still have that vigorous look. So it's very important for guys to have that confidence, and patients are so happy when it's done. The problem is that it takes a long time for the hair transplant to see the final result. And that's the hard part.
So that's one of those things it's worth the wait on.
You just have to wait.
Just be patient.
You're gonna be happy, but you have to wait.
So you don't have to go bald if you don't want to go bald.
Nowadays, you don't.
Wow.
That's cool.
I can't believe you do that too. You're just amazing.
Well, this was such a fun podcast. I feel like I learned so much.
Me too.
Yeah. Oh my goodness. Well, thank you, Jared, for coming on the podcast. This has been so much fun. Go ahead and follow Jared at Dr.Jared Gopman on social media. Is that correct?
Correct. Thank you.
Dr.Jared Gopman on Instagram. He posts all of his before and afters. He gives so much insight. He's so interesting. I love following along. And he's my husband, so you just got to follow. Anyways, thank you all so much for tuning in to the Chattermouth podcast. We'll see you all next time.
Thanks so much.
Bye.